All right. Good evening, everyone. My name is Corey Boggs. I'm the Vice Chair of the Health Policy and Legislative Affairs Committee. And I want to thank you all for coming out tonight to join us as we discuss environmental justice disparities. I'm going to start off by introducing our panelists that we have. Very excited for them to be here and share their insight. We have Dr. Gaurab Basu. He's an internal medicine specialist who's affiliated with the Cambridge Health Alliance at Harvard Medical School. He's an instructor of medicine. His publications are focused on social medicine, global health, and health advocacy. We also have Dr. Aparna Bole. She's the Division Chief of General Academic Pediatrics and Adolescent Medicine and the Medical Director of Rainbow Ambulatory Practice at Rainbow Babies and Children's Hospital. She serves on the American Academy of Pediatrics Council on Environmental Health Executive Committee and the boards of Healthcare Without Harm, Practice Green Health, and the Ohio Environmental Council. We also have Miss Sarah Shu. She's a third-year medical student from the Warren Alpert Medical School at Brown University. She's also the co-founder of the AMS Environmental Coalition, a founding leader and current vice chair of the Medical Students for a Sustainable Future, and created the first ever elective on climate change and health at Brown Medical School. And we also have Dr. Taki Osbome Jelks. She's a nationally recognized leader in engaging urban communities and youth of color in environmental stewardship through hands-on watershed and land restoration initiatives, environmental education, and training. She's the co-founder of the Atlanta Earth Tomorrow program, National Wildlife Federation's multicultural youth environmental education and leadership development program. So thank you, panelists, so much for being here this evening. I have a set of questions established, but for those who are attending and listening on our various social media platforms, please feel free to drop any of your questions below, and I will make sure to get to them as we go throughout the night. So for our panelists, the first question that I have is, and you guys are going to be able to answer this quite well, what are some important organizations we should be aware of that are working towards addressing and tackling environmental justice and health disparities? Anyone wants to start?
I guess I can give it a try.
Okay.
What I'll first say is that there are, well, and thank you for having me this evening. There are a number of organizations across the country that work on environmental justice issues, especially from the perspective of health. A lot of these might be smaller community-based organizations in different locales across the country. In some cases, there may be alliances that bring together a number of different organizations. And so, it's going to look a little bit different in every community. So that's the first thing that I can say, that, there are going to be different organizations that can be tapped into across the country. But maybe a couple that I'll just kind of point out that are pretty noteworthy. One is an organization in New York called We Act for Environmental Justice. They are based in West Harlem, Northern Manhattan area, but they end up doing a lot of national level policy work on environmental justice issues, on health related issues. I mean, they're even looking at issues around, toxic chemicals in our, personal care products and that sort of thing. And so they're working on legislation on a number of issues related to that. They have a strong partnership with, I know, the Columbia University School of Public Health, the Mailman School of Public Health at Columbia, and they do a lot of community-based participatory research and translational research with Columbia that has been very pioneering in terms of environmental justice work. So I want to bring them up. And then I'll bring up a body that I am a part of, which is the National Environmental Justice Advisory Council, otherwise known as NEJAC. And this is a council that, a federal advisory committee that advises the U.S. Environmental Protection Agency on issues related to environmental justice, looking particularly at how exposure to environmental harms, intoxicants, how that impacts impacts communities. And so the NEJAC is a place that a lot of different communities from across the country come to and bring their concerns about pollution or other ways that they might be exposed to environmental hazards and stressors in their communities. And they look to the NEJAC to try to press for action at the level of the EPA in terms of policy making, in terms of the way that EPA enforces current environmental policies that are on the books, and also in terms of how EPA might address enforcement actions and cleanup of sites that might be negatively impacting human health and the environment.
Awesome.
I could take a stab at that question too. Those were some great examples. I was going to mention We Act as well. One thing I would say is that there are some really wonderful, local, really rooted in community environmental justice organizations. So the answer to the question definitely may vary depending on where you are. Here in Cleveland, Environmental Health Watch is a small but very mighty environmental justice organization. There is, in addition to We Act in New York, there's Uprose in New York. There's El Vejo in Chicago. So there are many local environmental justice organizations that are really grounded in community that I think are worth knowing depending on your neighborhood. There may be one in your backyard. And in terms of some coalitions, the Climate Justice Alliance is one that I follow. And some of the organizations that we've named are part of that. So the Climate Justice Alliance, it's a great social media follow, and they put out some really great content. And their leadership, I think, is really wonderful. The Indigenous Environmental Network is another one that is worth knowing about. The Sunrise Movement, as a pediatrician, I work a lot with youth climate advocates. And so I think it is important to know that there are some really wonderful youth leaders who are fighting for environmental justice. And then I just want to put a plug in that sometimes organizations in our communities that are fighting for health equity, who may not call themselves environmental justice organizations, have a strong interest in environmental justice and are important partners for us. So for example, in my community, there are organizations that are fighting for birth equity and equity in birth outcomes, reducing infant mortality. And so they may not have environmental justice in their name, but we work together a lot on integrating environmental justice into birth justice. So I'll stop there. I'm sure others have ideas as well.
I'll maybe just make the quick comment that, I totally echo the importance of these kind of local organizations. There's an organization here in Massachusetts called Green Roots, which has been a really wonderful organization for me to kind of learn from and partner with. And maybe what I'll just make my comments around is that maybe describing, as I see it, that historically there's been a little bit of tension of environmental justice organizations. They're doing great justice-oriented work. And that hasn't permeated into the kind of big greens, they call it, the big climate organizations like the Sierra Club or NRDC and things like that. So before we started here, we were having a conversation of kind of how we found ourselves into this work. And I think this panel really is anchored in issues of justice and racial equity. And I would say, there's a real reckoning that's happening with these big green climate organizations that I don't think I felt like a natural home to for my work in the past, that I think is now really using this lens of racial justice, social justice in a more effective way. So I'll just I think that's a landscape that I see happening and an opportunity to kind of really shake these bigger organizations as well. And then there's the kind of the medical organizations and really kind of amplifying the healthcare professional voice. So Medical Consortium on Climate and Health, I know Aparna does a lot with them. I work at Harvard Sea Change, which is the climate center at the public health school here. And I want to give Sarah's organization a shout out, the Medical Students for a Sustainable Future, a really awesome organization that shows how students are really kind of shaking the landscape up of really creating the connections between climate and health justice.
Awesome. And actually, that is a great segue into my second question, which is, what are some ways that students can actively, on a smaller scale, advocate for environmental justice? And Sarah, I would love for you to give your insight, because you're kind of like the quintessential prime example of this. So if you could just kind of speak to what kind of sparked your interest in the organization that you established and what really inspired you to get involved?
Yeah, absolutely. And before I begin, I just want to thank you all again for hosting this panel and name that I'm calling in from Providence, Rhode Island today, which stands on the occupied lands of the Narragansett tribe. But, to your point and to the points that everyone else has made, there are, just so many local organizations doing incredible work in this space. And from a medical student lens, I think when I think about what medical students can do actively on a smaller scale is really just support these organizations. What funding can medical schools or medical students get to support these individuals' work? And really just like show up to the meetings, see what their concerns are, see ways in which the platform of medicine can, what medicine can give to provide and amplify their voices. Other things I think of are like, how can we invite members of our community to speak about how environmental racism is affecting their health? And how do we compensate them for their time? I think I'm constantly learning from Dr. Basu that stories are immensely powerful. So how can we amplify these patient stories to give them, shed light on what's happening in terms of environmental racism. And so that's what I think of, in terms of what medical students can do at the local level. And the reason why we started Medical Students for a Sustainable Future was really that we found that it was incredibly isolating to do this work alone. And it can be really powerful when you get a lot of people together backing and doing the same work. And so when we first started, we were just a group of like 6 medical students interested in this work. And now we are an organization of over 390 medical students at over 83 medical schools. And so just highlighting some of the incredible environmental justice work that some of our medical students right now, I'm thinking about our Minnesota medical students who are mobilizing to support Indigenous groups who are opposing the Line 3 pipeline. For those of you who may not be very familiar with this, it's a pipeline that's poised to run through northern Minnesota, but it would violate Indigenous treaty rights and release an estimated, I believe, 50 coal plants worth of emissions. And it would be communities of color and Indigenous communities bearing the brunt of these emissions. And so the medical students there and the MS4SF chapter there have really done incredible work to amplify the voices of, for example, Honor the Earth is one of the community organizations who's opposing this pipeline. I'm also thinking about medical students in Chicago. I could go on and on about the incredible work that they're doing, but there's, I believe, a metal shredder that's awaiting final permit to move from the north side of Chicago, which is higher income, largely white, to the southeast side of Chicago, which is largely Black and Latinx communities. And medical students there are working with physicians to speak out against this just blatant act of environmental racism and gathering support from healthcare workers to call for the denial of this permit. So, by joining together medical students nationally through MS4SF, are helping support them through these efforts. And just really quickly, I also just want to mention that medical students have a lot of power at the institutional level as well. And when we think about that, only 15% of schools worldwide teach about climate change and its disproportionate impacts, we have a lot to do to keep pushing our institutions. So I'm sure we can talk more about this later, but there are awesome tools that we can use in terms of institutional advocacy.
And a major kudos to you for your part in institutional advocacy by creating that climate change elective that is currently at your school. Are you aware of how many students have taken it thus far?
So it was actually a one-time elective that was given in the fall, I guess in pre-COVID times. I think because of COVID, running this elective was a little bit more difficult because of how many, faculty that we were bringing in from, outside of Providence, Rhode Island. But what we are hoping to do now is more, permanent 4-year longitudinal planetary health curriculum. And I guess I would just highlight here is that if anyone is interested in doing this, the planetary health report card is a great way to get started. It was inspired by the White Coats for Black Lives Racial Justice report card, and it allows you to grade your institution on planetary health competencies. And what's super exciting is there's an expanded focus on environmental justice metrics this year. So this is a great way to get the conversation started amongst students and faculty. So pushing for faculties to start a task force maybe to incorporate this longitudinal required curriculum.
Awesome. So another question for the entire panel. Why do you think this aspect of racism is not widely discussed compared to other issues?
I think about this a lot. Maybe I'll jump in on this one. For me, I came into climate change work from a background in human rights and racial justice work. So I really kind of start from those frames and apply them to this work. And I know my colleagues here do as well. What COVID has taught us, what climate has taught us is that we have they're issues that turbocharge and activate the fault lines of injustice that exist in our society. There's that saying that every system is perfectly designed to get the results it gets, right? And so we have to start the question of kind of understanding how climate change and racism work hand in hand by asking ourselves, how did we get here? How did we get here to be facing an existential threat? To be facing the ways in which communities of color are dramatically disproportionately being impacted by climate change. I would say in the United States and with kind of my global health background, really want to amplify the impacts around the world. And it's because some people benefit and some people are harmed, right? And Dr. Kamara Jones is a real inspiration for me, and she describes racism as a system of structuring opportunity, right? So it is structured opportunity, so some people get wealthy, that they can connect with politicians that continue to support those policies so they can continue to get wealthy, and communities of color are breathing in air pollution. They are at the locations that are getting displaced, will continue to get displaced around the world, food insecurity, water scarcity, natural disasters. So it's a system that works well for people who are trying to make money, who don't care about the inherent value and dignity and worth of every human being. But what's hard about it, and it's hard to wrap our minds around, is that climate change is hard to get your head around, right? Every day, health professionals are trying to take care of patients and take care of people, and there's real immediate things that are causing a stimuli to react. In climate change, we see that sometimes with the major natural disasters, but it's slowly warming our planet, destabilizing our planet in a way that is causing catastrophic harm, but is sometimes hard for us to get our mind around. And so it takes, I think that's why the health lens is so valuable, that we can do the translational work of saying, you may not understand atmospheric modeling or, some of that kind of science, but here are the impacts on human beings. Here's the impacts on our health, and really to anchor in on the spotlight of issues of health equity and racial justice is a way that I think we can play a critical role of making it in our consciousness, which is just so critical for making change.
Anyone else have any other thoughts?
The only other thing that I will add is that when we think about the way that the environment impacts our health, it's just something that people don't always think about, especially if you're not necessarily living in an environment that is severely impacted or degraded. It may be more top of mind for people who do live in such communities. I know I came into this work because of the time that I grew up in Baton Rouge, Louisiana. I'm originally from Mississippi, but grew up for several years in Baton Rouge in what some people consider to be the Cancer Alley corridor, this 85-mile stretch of land between New Orleans and Baton Rouge, Louisiana, that has over 100 or so chemical companies, petrochemical companies, and other pollution-generating facilities. And when you look at, health data from this area, you can see those connections between what's happening in the environment and the health status of the people. I can remember, living there, and the water water always smelling and tasting bad, the air always, smelling bad, the pollution index was always high. But it wasn't necessarily something that I thought about before I moved there, until I was, sort of in that situation. And, I was fortunate enough to live in, what is considered a middle class community, but we were still impacted by those hazards and stressors in our community. In fact, my mother was diagnosed with breast cancer, and it's not that, we can make any connections about what we may have been exposed to in her diagnosis, but really just the fact that that possibility existed. It just kind of opened my eyes to the impacts of the environment. And it opened my eyes to understanding how living in a polluted environment can have a detrimental impact on, various health outcomes. And so a lot of times it's kind of one of those things that, I don't think a lot of people think about. Some people think it's, maybe a luxury to be concerned about, what's going on in the environment when we think about, other things that are deemed a lot more immediate, like, do people have food to eat? Do they have, money to pay their bills and to pay rent, or those types of things. But if we kind of, peel back the layers of the onion, we find that the environment, is so interconnected with all of these things. As we talk about the social determinants of health, these conditions that people are born into, that they live in and grow up in and age in, these things have a serious impact on health, but it's just something that, tends to be overlooked, especially when, you're not in a situation where you can readily see some of those impacts.
If I could jump in here too, I first of all want to thank Sarah for reminding me to take a breath and express some gratitude. I really appreciate the opportunity to be here, and should have said that I am speaking to you from Cleveland, Ohio, which is the ancestral home of the Erie tribe. And I want to say briefly on this question, and then I'd love to go back and just say a little bit more about the power of students to make a difference if I could. But just on this question, I think that what Dr. Basu said about the environmental movement, there is embedded racism in the environmental movement and a lack of comfort with using language historically about racist systems that create environmental injustices. So I think that's a big disconnect within the environmental movement. And then I think a lot of us who work on health equity are not accustomed to using the vocabulary of environmental exposures. A lot of times when we talk about social determinants of health, we're really talking about environmental determinants of health too. They're really kind of indistinguishable when you get down to it. I do a lot of work on lead poisoning prevention and issues related to housing, racist urban planning policies, lead exposure, other environmental exposures related to homes and neighborhoods. I mean, really it's difficult to differentiate between social and environmental determinants of health, but I think we often don't use a common vocabulary that allows people to get their arms around that. And I'll say too, on the issue of climate action, sometimes it is hard to get our arms around it. And at this moment in time where we're dealing with COVID and the COVID recovery and this massive reckoning around systemic racism and climate action, it can feel like three separate really big problems that we're wrestling with at the same time. And so I think it's really important. I often say that those three problems are not really three different problems, but they're three ways of describing the same problem. That the system that created climate change that benefits the few at the expense of others was inherently vulnerable, and those inequities have been exacerbated by COVID. And building a new normal that is more sustainable and just is better for health, it's better for the planet. So all of these issues, the issues of systemic racism, COVID recovery, climate action, they're really not different problems. They're all the same problem. And I think it helps us to get our arms around it when we perceive it that way. And then just really briefly, I would like to just, first of all, say that students are incredibly powerful. And so whether in small or large ways, they can really move the needle on environmental justice. Sarah is a testament to that, and the Medical Students for Sustainable Future. I started my work as an environmental health advocate when I was a student. I had an opportunity to work on a case that our medical school was transitioning to like a case-based curriculum. And I really wanted to incorporate information about air quality and environmental justice into a pediatric asthma case. And I was allowed to do that. I started working on health sector sustainability issues as a medical student, working on waste audits and advocating for managing our kind of the externalities we create in healthcare. I started that as a medical student. And I think you can do things like incorporating environmental history into your patient care. You can in your advocacy work as a student, learn about community organizations that work on health equity and environmental justice and work together with them. We have students who do that in our institution. You can choose your language carefully when we talk about social determinants of health to talk about environmental determinants as well. And make sure when we're talking about issues like exposures to lead or other pollutants or heat or air quality or water quality issues, that we're actually talking about the systemic issues, the systemic racism that underlies the disparities in those exposures. And so using that language, when I talk about lead poisoning, I talk about racist housing policies being a root cause of persistent disparities in lead exposure. And I think that language is really important. So I'll stop there.
Thank you so much, Dr. Bole. The next question I have is, so what are some ways that you all foresee that you all will think that we will see the impact of environmental racism? So moving forward, it seems to be a trend that there is more recognition being brought to the importance of recognizing racism in the form of environmental health. But, you know, in certain respects, the horse is already out of the stable. So moving forward, how do you think that we will start to see populations being affected by this?
I can hop in really quickly. I think we have already seen and will continue to see the impacts of environmental racism on the health of our patients, especially on a population level. And when you ask this question, the first thing that comes to my mind, especially as Dr. Bole was talking, was, as climate and our environment continues to change, we will see the disproportionate impacts of environmental racism more and more. I'm thinking about how in Rhode Island, we are the fastest warming state in the continental US, and there are estimates that the number of heat wave days will quadruple. So from 10 days a year to 40 days a year. And this statistic is terrifying, but not necessarily for everyone. For some of us near Brown University's campus, when we think about this, we could hide in our air-conditioned homes, still work out in our gyms with AC. We could still maybe even walk outside because there are trees providing shade. But just a few miles north from Providence, there's a community that's, predominantly a community of color, and that's just not the case. We had a group of high school students, all students of color, working on environmental justice from Groundworks, Rhode Island. They came to speak to our climate and health elective, and they told us that, just for fun, they decided to walk and see how far they could go without seeing a single tree. And I think they could walk for an hour without a tree. And because of that, that's shade inequity. And one of my colleagues, Angela Zhang, did a phenomenal episode on this. But because of that, some neighborhoods can be upwards of nearly 10 degrees hotter on the same day. And this puts people at risk of heat-related illness, for those who don't have AC, students who have to walk to school or walk to work. And this is because of, I think, what Dr. Bole was getting at, was that our communities have been set up for decades due to structural racism and redlining. And it has made it so that some communities will be and are more at risk from climate change than other communities. So the fight for climate justice is really a fight for racial justice as well.
Can I just add to that? I think that's really powerfully said, and all the comments, I'm really just resonating with everything that everyone's saying. But an example, I'll maybe give two different situations that make me really angry to kind of spotlight how this is playing out. So one issue I think a lot when, Sarah's describing how hot Providence is warm, Rhode Island's warming, and the numbers are similar up here in Massachusetts. We're at 1.7 degrees Celsius post-industrial, so like 70% warmer than the rest of the country. So one of the first things I think about is expectant mothers, pregnant women. And so there was a big meta-analysis last year showing that exposure to air pollution and severe heat causes premature labor and low birth weight. And so that bothers me so much, the idea that we are creating this exposure to extreme heat that is not only a gender equity issue and a racial justice issue. And the study further showed that Black women have a far greater exposure risk to that. So that just like bothers me in my core as a parent, as a physician, that's like unacceptable. I'm going to pull back to the global lens again, and just talk about it, in that sphere as well. I think a lot about, I have a patient who is a farmer from Central America. I think about farmers a lot when I think about the intersection of racism and climate change, environmental justice. The farmers are working out in the heat day in and day out. And he developed a condition called CKDU, or Mesoamerican nephropathy. And so because he was out in the heat and exposed to severe heat over years, there was recurrent acute kidney injuries that are happening to his kidney. He came to the hospital thinking he had a mild viral syndrome, and his kidneys were in failure. It completely upended his life, young guy. And so these are things that, I really, acknowledge. Sometimes it can feel invisible because we can't see greenhouse gas emissions or air pollution all the time. But these are things that are just poisoning our capacity to thrive and to take care of people and to have a just society. Hopefully we'll get to some hopeful stuff, because this feels hard and heavy. But on the flip side of this is that, and I just want to kind of echo what Dr. Bole said, is that these are, the same issues kind of really converging. But, we have to have a vision of how we go forward, and we get to the deeper principles of how we want to live together and take care of one another. So I often say that climate change, environmental justice is fundamentally about our relationship to the earth, to each other, and future generations. And we've got to fix those relationships and really do it with the justice lens. And the thing I would also say is that we have the capacity to solve so many things at once if we get down to that level and operate from that place. And so, I just acknowledge that sometimes this feels overwhelming and paralyzing, all of these big issues that we're facing right now. I hope that offers us the opportunity to really transform and think about something different, fundamentally different. And I think that gives us a real opportunity to break the shackles of the ways we've done things for so long and to imagine something new.
So much, Dr. Basu. Did anyone else have any insight that they wanted to share?
Just one thing that I'd like to add, and I appreciate Sarah talking about Providence and the issues around extreme heat. I'm in Atlanta. I don't think I mentioned that before, and actually embarking upon a project right now. I teach at Spelman College in the Environmental and Health Sciences program, and we're partnering with Georgia Tech and with community-based organizations like the West Atlanta Watershed Alliance, Partnership for Southern Equity, Harambe House, and others to launch something that we're calling Urban Heat ATL, in which we are trying to look at heat variability across the city, looking particularly at historically redlined neighborhoods, also at areas where we have high populations of communities of color. The interesting thing about Atlanta is that we have some concerns with respect to the urban heat island effect and how it might be impacting certain populations. But because of white flight in the 1960s, we have in Southwest Atlanta in particular, a large, Black population living, kind of in areas that are forested and that are covered, in trees. And what we're seeing in places like Atlanta and in other places is this gentrification and displacement that is coming as a result of new developments in areas that have been long neglected. Also, there are new parks and green spaces that are being implemented in some parts of the city to address climate change issues. And as these new parks and green spaces are being developed, with the notion that we want to build cities that are more resilient, that we want to advance health equity, what isn't happening is what needs to happen on the policy level to make sure that people can stay in place to really enjoy these new benefits and amenities that are being implemented. So there are a couple of different sides to things. Sometimes you have these communities that have been long, kind of undervalued. The resources have been divested, from those communities. You don't have things like the parks and green spaces or trees. But then as those things start to be introduced, and brought into those communities after a long time, the people who've lived through the poverty and through the pollution, through the lack of exposure to these positive amenities, can ultimately be displaced if there are not measures in place from a policy perspective, or other, actions, making sure that people have jobs and, that they, make a living wage. All of these things are tied together and connected. And so if those things aren't addressed, then people won't even be able to benefit from these positive amenities that are now being invested, in some places like Atlanta.
Okay. Dr. Basu, I think you kind of spoke to your fact a little bit earlier, but you may have another one. Another question we have is, what is your most memorable fact or statistic about environmental racism? And I'll add one more or a sub question to that. Based on that fact, what is really pushing you to continue in the fight for environmental justice and equity?
Yeah, we've touched upon redlining tonight a bit, and one study I thought that was very valuable. Jeremy Hoffman did a study showing that redline communities are 2.6 degrees Celsius hotter than non-redline communities, and that shows again just echoing the theme here about really thinking about how we've created the structures we have, how we have structured opportunity and the lack thereof for certain communities, and kind of how purposeful those policies were, allowing the racist policy to exist for 34 years until the Fair Housing Act. So the intentional decisions were made, and we need to reckon with those and think about its widespread implications. The one other maybe stat I'll add is, again, sorry to keep going to the kind of global lens, but it's something that really draws me in, is that the 7 million people were displaced in the first half of 2019 from severe weather events, so the largest ever. So I just really, there's some pictures when I think about this stuff that keep me up at night. And I think about young families running away from natural disasters. I work for a global nonprofit that was in the midst of a COVID surge while Cyclone Amphan was bearing down on this community. And that just bothers me so much, that these communities around the world that have had such a small carbon footprint, have not contributed to this problem, are bearing the brunt of the lifestyles that the United States and other wealthy countries have done. So I'll just say briefly that, I've had moments of feeling very overwhelmed and very scared, and, as a parent, really feeling like, how do we move forward? I've gotten to the place where I feel courage. I feel like to embrace the bigness of these problems, and to I think there's unprecedented opportunity that is like literally right now happening. So for people who are trying to find their place into this work, the thing about big problems is that you can find your way into any piece of it. And so you don't have to change who you are or what you do or what you care about. But I guarantee you, there is an implication for environmental justice and climate change in the thing that you care about. And if you can speak to it, if you can speak up about it, you can find the connections of these things. I'm telling you, that's what we need to be able to make this kind of profound change we need to make.
Well, I have a few favorite statistics that I can share. One, when I say favorite, I'll say these are kind of go-to statistics that I talk about a lot. One is that in the United States, race is the best predictor of proximity to environmental hazards. And that applies across many types of hazards. I think that's important for us to know and to communicate. When I talk about a very immediately local environmental justice issue here in Cleveland, I talk a lot about lead poisoning. The prevalence of lead poisoning in Cleveland is about twice, just at baseline, what was the prevalence of lead poisoning at the peak of the Flint water crisis. And some of the neighborhoods where my patients come from, as many as 1 in 4 children are lead poisoned. I just want to say that some of my other statistics will get to what keeps me hopeful and going in this work. And I do hope we talk a little bit more about solutions. A couple of other statistics. So staying with lead poisoning, the return on investment for lead abatement in housing is astronomical, because, and depending on how wide you cast your net, you look at school performance issues, interaction with the criminal justice system, lifetime productivity, just you name it. There are so many consequences over a course of a lifetime for lead exposure. The return on investment for lead abatement is astronomical. It's the only thing that comes close is childhood vaccines. I'm going to switch to say something about climate change and air pollution. There was a recent study that maybe it was a few years ago now, out of California, that the closure of 8 fossil fuel powered power plants, coal and oil plants, was associated with a 20% decrease in preterm births in pregnant people that lived around those power plants. I've heard some of my colleagues say, if we had a piece of technology that decreased premature birth by 20%, we would be shouting it from the rooftops. Insurance companies would be paying for it. We have that technology. It's clean energy. And so I think that what keeps me going is that solutions to these issues of environmental injustice are solutions to some of the biggest health problems that we face. And as a primary care doctor, I treat the consequences of extreme prematurity all the time. I take care of families who have suffered infant loss and infant death. I have kids with asthma. I have kids who are obese. I have kids with significant mental health issues. All of the solutions that we talk about, they seem like really big problems sometimes, but when I think about statistics like the opportunity to decrease preterm birth markedly by cleaning up our air, transition to clean energy helps kids be more ready for school, because air pollution is toxic to the developing brain. We talk about school readiness in pediatrics all the time. Clean air is a solution for school readiness. Clean air is a solution for better birth outcomes. So accelerating to a clean energy economy like this is a solution to some of the most intractable health problems that we struggle with in clinic all the time. Similarly, right, like sustainable, vibrant, inclusive cities are good for people. It's better for community, better for the planet. A more sustainable and just food system, better for workers, better for our health, better for the planet. So some of these kind of downstream issues that we grapple with our clinic visits day in and day out, the solutions that we're talking about to some of these big environmental justice issues are solutions to those exact health problems. And that's what really keeps me going. I think that makes me feel very hopeful. And I do think we're in a critical moment in time right now.
Thank you, Dr. Bole. Sarah, Dr. Jelks.
Dr. Bole took my first one, which was, and I'll say it again, though, just for a little bit of emphasis, that, race is the best predictor that we have in terms of understanding where toxic and hazardous waste sites are placed, in this country. And there have been a number of studies that have shown that and back that up. So that's important as we talk about, kind of why this, hasn't been an issue that has received maybe as much attention as other types of racism. One thing that people often sort of try to use to combat, that statistic basically is that, isn't it, about income level? And obviously we understand that race and income level are highly correlated, especially when we talk about how opportunity and how advantage has been structured in this country. It's been, unfairly structured so that some people have an unfair advantage and others have an unfair disadvantage. So, it's really important that we, understand that race, even above income level, is that predominant factor. Another thing that is tied to that is that increasingly research is showing us that the zip code may indeed be the best predictor of future health and well-being. Perhaps better than, some people say better than the genetic code. Looking at someone's zip code and understanding what exposures there may be in those locations is a good indicator of health. To take it back, locally for me here in Atlanta, on the west side of Atlanta, in some of our neighborhoods, there is an almost 25-year difference in life expectancy between neighborhoods on the west side and some of the other neighborhoods in Atlanta that are not that far away from each other. But it looks, the landscape looks very different when we look at these various, factors factors related to the environment. When we look at different, environmental pollution sources, and when we look at the other social determinants of health, so that, almost 25-year difference in life expectancy, is I think can be, closely correlated and tied to environmental factors. And increasingly, we've got to be paying attention to those types of things.
Such good points, and I feel like I'm just like furiously writing down all of these as well. But I had a couple more that I wanted to add, and I thought Dr. Bole was going to bring this up. But another recent study about air pollution that came out, I believe, said that nearly 1 in 5 global deaths can be attributed to fossil fuel air pollution, and I found that study just like absolutely horrifying. But other things that I wanted to bring up, because somehow we've managed to avoid the topic of COVID, this conversation, but I think there was a study that showed that even like very tiny amounts of air pollution over a long period of time can make an individual 8% more likely to die from COVID. But if we think about who is living in areas of poor air quality, I think there was an American Lung Association report that showed that people of color are 1.5 times more likely to live in areas of poor air quality. So we see this reflected in our communities that are that have been hardest hit by COVID, which are our Black and Latinx communities. But in terms of wrapping up on what keeps me going, despite of all of these statistics, is I think, especially in medical school, it's been community. I think before MS4SF was founded, I found some community and hope within the Sunrise Movement, which is what Dr. Bole had mentioned earlier as well, and just how they ground everything they do in like racial, economic, and environmental justice, and have found just such creative solutions, especially legislative solutions to these difficult issues. And with MS4SF, just having such a large group of medical students working on this together just brings me so much hope. Knowing that right now, I think at least 30 different medical schools have different proposals going on, pushing for their faculty members to include like a longitudinal environmental racism, environmental justice, climate and health curriculum is just so exciting that we're training future medical professionals to be competent in this area.
Thank you all so much. We actually have a question from the audience. Zach would like to know if you all believe or have experiences where you found yourself having to interface with the political mechanisms in your communities and states to implement some of the solutions to the problems you mentioned. Is political pressure, electing like-minded political figures, etc., the best way to see material change? And I actually think Dr. Bole kind of spoke to this a little bit, but if you guys have more thoughts.
I can speak to this a little bit as well, although I'm not a physician, so it probably comes a little bit more naturally with my territory to interact with legislators and folks working on policy issues, although I know that the other panelists have done this as well. Through my role, not really as a professor, but through the work that I do on the ground, through community-based organizations like the West Atlanta Watershed Alliance. I've actually worked with our county in the Atlanta area to pass a piece of legislation, and it passed a few years ago, that would require that there be an environmental justice review if there was a new facility that wanted to, or a company wanted to build a new facility in a community, and that facility was deemed to be an environmentally unwanted, land use. So there has to be an environmental review done to make sure that these communities are not already being impacted by other pollution generating sources or environmentally unwanted land uses. And so that was the first of its that type of legislation, in this country, to actually amend our zoning resolution. The catch is that it really only covers the unincorporated areas of our county. It doesn't cover, kind of those areas that are incorporated in the city of Atlanta, but it's still a start to make sure that we have that, sort of policy in place, because the county, just as much as the city, is being impacted by different types of facilities, wanting to come in to bring their operations. And in some cases, in communities that are already overburdened with environmental hazards and pollution. And so this type of legislation has been something that is now proving to be helpful to communities to not add to their burden.
Thank you, Dr. Jelks.
Can I just add real quick, Corey? I'll make a brief comment, but I just think policy it's for me the whole ball game. I think that we have to make change, that we have to have effective policy. When I start thinking about how many cool policies there are, I get really fired up, because I just think it is, we have, it's there for the taking to do this transformation. There's some really brilliant, Dr. Jelks is just describing some, but there's so many powerful policies at hand. And I think a lot of those policies are made without the health voice at the table. And when I have engaged in local advocacy, when I've testified and things like that, I would just argue, whether a student voice, I think in many ways is even more potent. And, some of the courses I teach really, teach that kind of legislative advocacy approach, but do not underestimate the capacity to impact change at a local level or even at a federal level by entering the forum, the public forum, and really explaining the impacts. Because, the truth is, when you talk about health, you're making inherently kind of a moral and ethical argument. And people resonate with the argument for health. So I think it's a critical tool at our disposal to make policy change.
And I would have to agree. I think a lot of us, or I would say all of us on the Health Policy and Legislative Affairs Committee share that sentiment. And that's the main driving force behind us, doing the work that we do throughout the year. We see the disjointment between what's happening on the medical front lines and what the policies are. And so we're really just fired up about, providing the information so that, there's streamlining there and there's improvement.
I couldn't agree more. I think health voices and policy advocacy are critical, and I probably don't need to tell you all this. Your policy committee is doing such great work, but I would also just encourage, don't be shy about claiming anything health related as your lane. Whether it's talking about energy policy, transportation infrastructure. These are arenas where I think can be regarded as somewhat non-traditional for health professionals to be. I sometimes get some surprise looks from legislators when I show up at an energy-related hearing, but I think it's incredibly disarming in some ways for legislators on both sides of the political aisle to hear from, in my case, a pediatrician talking about child health in the context of an energy bill or a transportation bill. And so I just encourage you to know how powerful your voice really is. And like I said, I'm sure you have experienced this already in the work that you're doing.
I'll have to echo that too. I think especially in Rhode Island, where a lot of us can just walk to the State House. A bunch of medical students have testified on behalf of climate bills here. And every time we've just been astounded at how seriously people take our comments and our contributions. And I think to Zach, your comment, I think especially in this last year and working with Sunrise, I've just have had a renewed sense of respect for people who work in health policy and environmental policy. I think if you happen to live in New England, I think looking up the Renew New England policy proposals, I find that it's a very elegant sort of legislative, coordinated legislative proposal across the Northeast to, get good climate policy, but also get things like safe and affordable housing, clean water, minimum wage, all the other things that we need to ensure, a healthy and a just future for our communities.
All right, and we have just right at about 5 minutes left. So I just check with the audience to see if we have any last questions for our wonderful panelists. Want to respect everyone's time. Okay, if we don't, I want to thank you all so much for sharing your insight this evening. It's been wonderful. I personally always leave our sessions even more fired up than before because, as you all mentioned, sometimes in the fight it can be disheartening, or it seems like there's so much that we need to address, and it's like, where do you start? So it's just always nice to be in a room with like-minded people, the value in what we do, and really continue to push towards the mission and accomplishing the goals. So I really appreciate you all sharing your time and your insight with us. For those that are in the audience, if you all could take out your phones and scan, we have a QR code for you. We just want your feedback about this session. Also want to remind you all, if you have not, that our annual medical education conference, also known as AMEC, is coming up in just about 3 weeks. It's going to be April 1st through the 4th. So if you have not registered yet, please do so. Although it's going to be virtual, it's going to be amazing. So don't want you all to miss out. And I think the code should be up right now. Let us know if you can't see it.